Gentlemen, today is the big day. This video is going to explain when you receive all of your prescriptions and your products for your therapy, as well as we're going to go through each and every product. We're going to identify them. We're going to talk about what we're using them for. We're going to talk about your dosing schedule and how to better understand it. We are going to talk about your first injection and your ongoing injections. We're going to talk about any sort of estrogen control that you might have had with it, how to utilize that. And then we're going to talk just a little bit of best practices, things you might be experiencing, when to talk to us, and our schedule going forward. So first and foremost, welcome aboard, right? This is a life-changing therapy. This will make an unbelievable difference in day-to-day from a myriad of things, and does provide a ton of health benefits to us guys as we keep going on in life. This program is meant to optimize you. It's not a one-size-fits-all. This is a living, breathing program that truly morphs around you and is customized and individualized. As always, myself, Brock, we're in your corner. Talk to us anytime. Give us a text message, an email, let us know what's going on. We have an incredible medical staff there to support you, and we, of course, are in between that on the coaching side of things. So with nothing more, let's get started. Use this video for when you receive all of your items. First and foremost, going to come packed up into, mine came in a FedEx bag like this. Most of them come in a soft bag. It may come in a box or a different container, but upon opening it up, right away what you're going to notice is you should have multiple items. Many times your anastrozole or any estrogen control will be shipped in a different box or a different container. I did get this yesterday, but we'll talk about that in a second. But opening up what was inside of this FedEx package, so I have two packages right here of syringes, 1 and 2. Inside of those syringe packages are also my alcohol swab wipes, or my sterile wipes. I will have all of my paperwork and instructions, and then I will also have 2 boxes. One I have already opened and got ready. That will have my testosterone cypionate in there. So first and foremost is to make sure that we read through our directions very carefully. In your directions, they are going to state what to inject, how much to inject, and how many times per week. When I'm looking at my therapy right here, it is to inject 0.4 ml. That's 0.4 milliliters, and I'll explain that in a second when I pull out the first syringe. And to do that twice weekly in either the thigh or the glute. Now, that question is tossed around a lot. It's truly a preference on which one feels better for you. I'm a glute guy. I prefer it in my glute. I do the twice a week. I do Tuesdays in the right side, Thursdays in the left side, or vice versa. When using injection sites, it's generally, again, a best practice to try to move that injection site around a little bit each time. It just keeps it from getting any scar tissue or uncomfortable side from injection. So that's a great tip right there. Let's dig into the actual therapy itself and really get us set up for the first injection we're going to take. So as you can see, I'm going to open up my bag right here, and what you're going to have is you're going to have one syringe, which is in my green package right here, and it's going to have a heavier needle in it, a bigger needle. This needle right here is a 21 gauge needle, so it's a little bit thicker. This is what we call a draw needle. We will utilize this large one to draw the testosterone out of the vial, and then we'll switch that needle with our injection needle, which is a smaller one just for our comfort. So I'll take this out from the draw syringe. I'll also take out an alcohol wipe, and then I'm going to take out just my needle tip or my needle point right here, and this happens to be a 25 gauge needle point. This will be my injection needle. So right now I have 4 items at my hands right here, and I have my testosterone cypionate. First thing I'm going to do is I'm going to go ahead and open up my draw needle. I will get my draw needle out. I will get my cypionate out. I will open up my alcohol wipe. I will take my alcohol wipe. I will sanitize the top of the syringe. I will also sanitize the location at which I'm going to inject. Once I have that set up, I will take my draw needle. I will remove the cap on my draw needle. I will insert it into my testosterone. I will then draw 0.4 milliliters and I will draw past that line. I will push it back up to the 0.4. I will hold, I will remove the testosterone. After that, I will keep this needle upright. I will already have my 25 gauge needle unwrapped and prepped. I will simply remove this needle by twisting it, keeping all my testosterone inside of the syringe here, and I will apply the new 25 gauge needle for injection, and we'll be ready to do our first injection. Now, once we do an injection, we're going to go ahead and have our needle set. Our place we're going to have to make sure that our local site is cleaned and is sanitized by our alcohol wipe. When you go to inject, use a slow, steady motion. Insert your needle slowly into your glute or thigh, inject slowly with the testosterone, and remove slowly. After that, put your safety caps back on each one of them, discard everything that we use today. Put your testosterone in a dry place. It does not have to be refrigerated. It can be in a medicine cabinet or anything along those lines. That takes us through our injection site. Now, it's really pretty straightforward. People are a little bit nervous around the needle side of things, but I can assure you, once you do this a couple of times, it is going to feel very, very normal, and it's going to feel very, very at ease once we get used to these smaller injections. Let's talk a little bit about having some estrogen control. So what I have right here is anastrozole. And if you read the directions on your anastrozole, mine says to take 1/4 tablet or 0.25 milligrams by mouth 1 to 2 times per week. Now, best practices, and if you talk to many MDs, when we talk about anti-estrogen or estrogen control, this is something that you want to do by feeling, which means that in the beginning, I use a really small amount. I take these capsules and I split those up with a razor blade in quarters, because I'm only supposed to take 1/4 1 to 2 times a week. I'm going to go the minimum in the beginning, and I'm really going to feel how my body responds to that. The best part about Sculpt and our men's optimization program is 6 weeks from now, we are going to schedule another virtual consultation with our PA to go through our details, to analyze how we feel, to look at how we respond to it, to adjust any dosing or dosage we need, to change the regimen if we have to change a regimen at all. I want you guys to know that you're incredibly supported, and we look forward to walking this journey with you. Any questions that arise at any time, reach out to us. We will try to get back to you as soon as possible. And along this journey, we're going to have a lot of tips, tricks, and other things that might help us to, of course, optimize and live the very best life we possibly can. So enjoy your time, fellas. Make sure you get in our ear about anything that's on your mind. And first and foremost, set up your regimen. What days are you going to inject? Stick to your plan. Make sure that you're safe and clean. Make sure we understand our dosage cycle. Make sure we have our anti-estrogen. And then, of course, as we go through our process, we're going to check on it through multiple times until we have that next 6-week virtual, and then a 3-month where we'll get our labs again. All right, fellas, take it from here. Thank you.